mental health care within family health teams. My colleagues and I have spoken about the crisis in healthcare, and we are hearing directly from family, doctors, and healthcare workers that mental health issues are becoming more prevalent in health settings, especially among youth. The Alberta Medical Association conducted a survey released in June, which found that 77% of parents reported the mental health of their child was worse than before the pandemic. And stigma around accessing supports and receiving help still exists. Mental health care is health care. Albertans should be able to access care when they need it, no exceptions. Primary care focuses on early identification and prevention. This is extremely valuable in mental health, just as it is with physical health. Primary care providers should have tools and support necessary to screen for mental health issues and provide quality care. Our plan does this. Increasing team-based care allows more professionals to work in primary care, which will increase access while also providing more comprehensive care. The composition of family health teams can include mental health professionals, the counselors and therapists who provide therapeutic supports, mental health nurses who can complete assessments and work on care plans with patients, and numerous other allied health professionals, including social workers and community navigators, to support patients. Team-based care also ensures that patients' mental health issues are understood broadly by team members, so patients do not need to repeat their health needs to multiple people over and over. Many primary care networks and clinics in Alberta do employ health staff and are doing an incredible job at providing integrated care. But the current funding for this work is too little, and clinics can often only support one staff on a part-time basis. Our plan to hire 1,500 additional non-physician team members will allow clinics and primary care networks to significantly expand the mental health services they provide. Our plan also commits to working in collaboration with communities and community organizations that already do this work, often on a shoestring, to support the best possible primary care in their community. For example, family health teams could partner with schools, continuing care, and other community organizations. A counselor or any other mental health team member could split their time between being in a clinic and out in the community. There is so much opportunity and potential to provide integrated community mental health support, but the government needs to provide the right support and leadership. An Alberta NDP government will be committed to expanding mental health care. We have already committed to providing all Albertans with 5 insured mental health sessions, and now we are committed to expanding access to mental health care through family health teams. But that's not enough for me. I am so excited to turn things over now to Karen to speak further about family health teams and how they will benefit Albertans when it comes to their mental health.
Thank you, Laurie. And as Laurie said, I'm the co-chair of the Calgary Mental Health and Addictions Community Strategy, and I proudly support Alberta's NDP Family Health Teams Plan. I refer to myself as a community advocate, a person with extensive lived experience, starting in my childhood, growing up around major depression and addiction, following me into my adult life, marrying into mental illness, addiction, and domestic violence. Often people have no idea where they can go and to get the mental health when they have these concerns, when they're in this situation. They can't think, but they're also shrouded with the shame and the stigma that's associated with the situation that they're in. In my case, my late husband had many options. He was in and out of emergency. He was admitted to the psychiatric unit. He went into recovery multiple times, and that eventually resulted in suicide. The children and I were managing all of that, trying to live our own lives, our own normal, healthy lives, and we didn't have any trauma-informed personal relationships, and we were not connected to mental health community resources. With family health teams, primary care networks will integrate health, mental health needs, and community-based and coordinated services and develop clear pathways for Albertans. Connection to community resources and people will strengthen prevention and early intervention before it escalates to a crisis. On average, it takes a person 5 to 7 years to get help, and at that point, the crisis situation, they've lost everything, their marriage, their house, their money, and at that point, they're contemplating suicide. That is why we need both downstream screening for care and upstream to avoid those crisis situations. And that is why it's so important for Albertans. 1 in 4 Canadians are struggling with mental health or mental illness, which means 3 out of 4 are either caring or know someone that is struggling with mental illness. And those people are the loved ones, they're the caregivers, like ourselves, and we need support and wellness too. Increasing services through primary care will allow entire families to have easy access to mental health care, preventing mental health crisis. This includes a plan for both wellness and prevention, and it's why I believe so strongly in integrating mental health with primary care and why I'm here. I'm proud to support the Alberta NDP Family Health Teams Plan. Thank you.
Thank you. Well, thank you so much, Karen. And with that, we'll take your questions.
All right, thank you, Laurie, and thank you, Karen. We will go to the phones for questions. Just a reminder for those on Zoom to use the raise hand function, and for those on the phones to use the *9 function to get into the question queue. And with no questions on the line, we will wrap today. Thanks, folks.
So much for watching, and to learn more, check out albertasfuture.ca.